Once you pass 60, it's funny how every new ache gets blamed on the same thing: aging. Sore knees? Must be age. Achy hips? Age. Back pain? Definitely age. But what if some of those getting older pains actually have nothing to do with age, and everything to do with what's on your feet? I learned this the hard way. For months, I blamed my morning foot stiffness on getting up there. Then, a podiatrist looked at my shoes and said, "These things are older than some of my patients." He was right. The problem wasn't my birth certificate. It was my sneakers. Here's the truth. The wrong shoes can quietly throw off your balance, strain your joints, and make muscles work harder in all the wrong ways. And because it happens gradually, you don't realize your footwear is the culprit. You just chalk it up to aging. Today, we're going to look at how shoes can cause pain that feels like it's just part of getting older, and how the right choices can give you more comfort, stability, and energy without spending a fortune. The silent culprit under your feet. "Your shoes are like the foundation of a house," said Dr. Lewis, a foot specialist I met while researching this topic. If the foundation tilts, the whole structure shifts, walls crack, doors stick, and pretty soon, you've got problems in places you never expected. Most of us never think about it, but every step we take sends a chain reaction up through our ankles, knees, hips, and spine. If your shoes are worn out, unsupportive, or simply not right for your feet, that chain reaction becomes a ripple of micro-stresses. Over weeks and months, those stresses can cause pain that feels like arthritis, muscle stiffness, or just old age. Studies from the American Podiatric Medical Association show that poor footwear can alter walking mechanics, leading to joint strain and balance problems. Even a small tilt in your foot alignment can shift your posture, making muscles work harder just to keep you upright. The sneaky part? You might not feel foot pain at all. Instead, it shows up as sore knees after gardening, or a stiff back in the morning. And because the connection isn't obvious, you blame your birthday candles instead of your shoes. Sometimes, the first step to feeling younger is literally a better step. The archenemy. "I never thought about my arches until they collapsed," laughed Irene, 88. "Now they're all I think about." The arches in your feet aren't just decoration, they're built-in shock absorbers. Every time you walk, they flex and spring back, helping distribute your weight evenly. But with age, or simply from years of wear and tear, the tendons and ligaments that hold them up can weaken. If your shoes don't support your arches properly, this collapse can start sooner, and the effects travel far beyond your feet. According to the Mayo Clinic, fallen arches can lead to ankle, knee, hip, and even lower back pain because they throw your entire body out of alignment. Here's the kicker. You don't need to have totally flat feet to feel the effects. Even a slight drop in arch height can cause your posture to shift, muscles to work overtime, and joints to take extra pressure. Irene swears she felt years younger just by switching to shoes with proper arch support. No new meds, no surgeries, just the right foundation under her feet. Think of your arches like the suspension system on a car. When it's working, the ride is smooth. When it's not, every bump in the road rattles you. Cushion confusion. "I thought the more padding, the better," said Robert, 82, holding up a pair of squishy sneakers that looked like marshmallows. Turns out, I was bouncing my way into more pain. Cushioning is one of the most misunderstood parts of shoe comfort. Too little, and every step feels like you're walking on concrete. Too much, and your feet sink in so far that the muscles and ligaments stop working the way they should. The American Academy of Orthopedic Surgeons notes that overly soft soles can actually weaken the foot and ankle over time because they reduce the amount of feedback your brain gets from the ground. That lack of feedback can hurt your balance and increase fall risk, a big concern as we age. On the other hand, shoes with rock-hard soles pass all the impact straight up into your knees and hips, which can aggravate joint pain. The sweet spot? Moderate cushioning that absorbs shock but still lets your foot feel and respond to the surface beneath you. Robert switched to a firmer, more supportive shoe and noticed less knee pain within weeks. As he put it, "It's like finding a mattress that's not too hard, not too soft, just right for walking through life." Common shoe mistakes seniors make. "I've had these shoes for 12 years, said Carol, 85, proudly holding up a pair that looked like they'd survived a hurricane. "They're broken in." The problem? They were broken down. Many of us wear the same pair of shoes far past their prime, thinking comfort comes from familiarity. But over time, the cushioning flattens, the support collapses, and the sole wears unevenly, all of which can throw your body out of alignment. Another big one? Buying for style or bargain price instead of fit. A too narrow shoe can pinch nerves and cause bunions, while a loose heel can make your foot slide and strain tendons. And here's a sneaky fact: your shoe size isn't fixed. Feet often get wider and longer with age due to changes in ligaments and arches. The American Orthopedic Foot and Ankle Society recommends measuring your feet every year or two, even if you know your size. Other mistakes include wearing slippers with no support all day, assuming all walking shoes are created equal, ignoring pain because you think it's just aging. The fix? Replace worn-out shoes every 300-500 miles of walking, prioritize fit over fashion, and try shoes later in the day when your feet are slightly swollen. That's their true size. Signs: it's the shoes, not your age. "I thought my knees were going bad," said Frank, 87. "Then I switched shoes, and suddenly my knees got younger." The tricky thing about shoe-related pain is that it often masquerades as normal aging. But there are a few telltale signs it's actually your footwear. 1. The pain changes with your shoes. If switching to a different pair, even just around the house, reduces discomfort, that's a red flag. 2. Pain eases when you're barefoot. For some people, barefoot walking on safe, soft surfaces lets the foot move naturally, reducing strain from bad shoes. 3. Symptoms worsen at the end of the day. If morning is fine, but pain builds after hours in the same pair, your shoes may be the culprit. 4. Wear patterns tell a story. Flip your shoes over. Is one heel worn more than the other? That uneven wear can throw off your balance and posture. Studies from the American Podiatric Medical Association confirm that even small misalignments in footwear can cause joint stress up the chain, knees, hips, and back included. So, before you assume it's just age catching up to you, try changing what's on your feet. You might be surprised how much younger you feel with the right foundation. Choosing footwear that loves you back. When I finally bought shoes that fit properly, I didn't just walk better, I stood taller, said Laura, 84. It was like my body sighed in relief. The right shoes can be life-changing, and finding them isn't about chasing the most expensive brand, it's about matching the shoe to your foot and your lifestyle. Look for proper fit, about a thumb's width between your longest toe and the shoe's end. Supportive insoles, good arch support, and firm heel cups keep your alignment in check. Stable heel, low and broad, not narrow or high. Lightweight materials. Easier on joints and less tiring for long wear. For some, custom orthotics are worth the investment, especially if you have unique foot shapes or chronic pain. They can be slipped into most shoes and last for years. And don't forget, even the best shoes wear out. Replace walking or running shoes every 6-12 months, depending on use. Research from Harvard Medical School shows that supportive footwear can improve mobility, reduce fall risk, and ease pain, sometimes more effectively than medication. Think of your shoes as daily partners. Choose ones that help you move freely, carry your weight evenly, and make every step a little easier. So, here's the takeaway. Sometimes the aches and pains we chalk up to just getting older are really just bad shoes telling a long, slow lie. The wrong fit, worn-out support, or too much cushion can quietly work against you for years. The right pair? They can give you more energy, better balance, and fewer sore joints, without a single pill or surgery. Think of it like this. Every step you take is an investment in your future comfort. Change the foundation, and the whole structure starts to feel stronger. So, before you accept every new ache as part of aging, look down. Your shoes might be trying to tell you something. And if you've fixed your footwear but the pain still lingers, the next place to look isn't your closet, it's your posture. In my next video, I'll share the small daily posture habits that can quietly cause years of discomfort and how a few tiny changes can make your whole body feel lighter. Because aging might be inevitable, but pain doesn't have to be.